morning, everyone. My name is Vincent Lyles, and I want to thank you for joining us today for Advocate Aurora's Health Living Well Community Conversation. And I am joined today by Dr. Ivey-Brown, who is one of our, is a medical director at one of our clinics in Oak Lawn, Illinois, and also a practicing physician at our Christ Medical Center in that community as well. Dr. Hammad Haider-Shah will be joining us shortly. He's the Chief Medical Officer at our West Dallas Memorial Center, Medical Center. And then we have a special guest today in terms of Cheryl Kniesel. Cheryl is an illustrator and will be recording this conversation visually, and we'll be able to share that with you after the conversation is over. But as all of you know, COVID-19 has brought unprecedented anxiety to individuals and communities. And as our most vulnerable populations have seen, the brunt of much of that, we wanted to provide them with resources and information to talk about kind of where things stand as it relates to COVID today. In particular, the vaccine. Many of us have heard lots of different stories and comments about the vaccine. We want to provide you with the facts to help demystify the information, try and share reliable, informative things for you to be able to share with your friends, family, coworkers as we move forward. All participants have been muted and your videos have turned off so that we can get the best recording of this event. And that we'll ask you to submit your questions into the chat box. And for Q&A, it is our intention to answer some of those questions and chats towards the end of our program. And it's also our intention to share with all of you the responses to those questions once this recording is over. So we're very excited about having Dr. Brown with us today. And as I said, Dr. Haider-Shah will be joining shortly. But Dr. Brown, I'm going to start with you and just talk a little bit about the vaccine, and in particular, give us maybe a quick little vaccine 101 lesson. What is it? What's it all about? And what's the plan for the vaccine from your perspective?
Okay, so the two vaccines that are available currently is one is made by a company Pfizer, the other one is Moderna. Now, with both of those vaccines, they are what we call mRNA vaccines. The M stands for messenger. People in our audience may have seen that a lot on the news, like mRNA. So what is that? So literally what the vaccine is able to do is through messenger RNA, it's able to introduce an instructions that are temporary in nature to our body to create a replica of what's called the spike protein. Think of it like as an individual fingerprint for the COVID-19. The vaccine is able to get our cells to make a replica of this so that it triggers our immune system to recognize that when the real thing has entered into our system, it's ready to attack and it's ready to go. In terms of why we are doing this, it really is another piece in the puzzle in terms of trying to battle this huge pandemic, and the vaccine is a wonderful thing in our arsenal, so to speak.
Terrific. It's interesting you make the comment about it replicating, or at least providing an inhibitor to the vaccine, the real vaccine spreading. And that may be one of the reasons you hear people talk about it creates, the COVID vaccine in the bodies. But interesting. And again, talk a little bit about why, if it's so important, why we're going about it in the way we are in terms of this phased approach. Many people have heard, okay, 1A, I'm not a 1A, I'm a 1B, kind of how does all that work, and why are we doing it the way we're doing it?
Sure. Okay, so really this is all guidance. Let's talk about 1A, 1B, what does all of this mean? It's the CDC's way of trying to stratify based off of an individual's risk of contracting severe COVID-19, or the possibility that an individual could come into contact with a lot of people and spread it. So they've created these different stages. There's 1A, 1B, and then 1C. So now what's in these categories? With 1A, the vaccine rollout is geared towards healthcare workers because we come into contact with a lot of people who are potentially sick with COVID-19, or if we were to get it and pass it to them, they could get really severely sick. Also within the 1A category are residents who live in assisted nursing facilities because they're some of our most vulnerable populations. The CDC then recommends that when the community is ready to enter into 1B, and lots of people have been hearing on the news, we're now going into the 1B phase. That includes individuals, at least in Illinois, over the age of 65. It also includes frontline essential workers. So what's a frontline essential worker? That consists of firefighters, police officers, postal workers, grocery store workers. All of those are in that category. Once we have, and teachers too. I'm so sorry, I should have said teachers at the beginning.
Absolutely.
I have 2 children of my own, very essential. Then the CDC recommends once that population has been vaccinated, we can then move into 1C. Ones who have underlying medical conditions who are over the age of 16, because the vaccine has been approved for individuals over 16. They also have stated we will hit other essential workers. This could be people in public safety, public health, communications, technology. After we've hit 1C, it's like everybody else that's left after that category.
Right. Terrific. You know, and you mentioned it's in Illinois, and I would say to our audience as well that it's it's very similar in Wisconsin in terms of the phased approach and the categorization of different people in terms of essential workers and so on and so forth. So for those in our audience who are in Wisconsin, they should know that the approach is very similar. But each state, and quite frankly, some of the health departments within those states also have different approaches and different ways they're doing things. And so it is important for us to get as much information as we can. So talk a little bit about why you as a healthcare leader think it's so important for us to get the vaccine.
Really, it comes down to this is what our key is. This is the way that, one, we help protect ourselves, and in help protecting ourselves as individuals, we help protect those around us. The people in our community, they may have chronic medical conditions that can make them ill or sick, or there may be people in our community that are quite healthy. They get it, but they pass it on to somebody else who can contract really severe COVID. So we're trying to help our community, and then the community will be helping globally on the whole. Just to kind of place this a little bit more in perspective, the experts, the numbers are still kind of evolving, but the idea is that if we can get, at least in the US, like 70% of our population vaccinated, numerically, that's around 200 million people, we can potentially achieve this idea of herd immunity. Now, that term was really thrown out a lot like towards the end of last year, but for those who may not have heard of it, the idea behind herd immunity is that within a certain population, if the majority of people are immune, then it's less likely that that particular disease, like COVID-19, will be passed amongst each other. People can develop herd immunity natural way by getting the actual disease, but there will be so much loss of life, so many people in the hospital, especially when we have a vaccination tool that can help us get there in a safe manner and help us all get to that point of normalcy that we're striving to achieve.
You know, 70% is a big number, 200 million people. I mean, that's a lot. I mean, if you think about, our most recent national election, there were roughly 150 million people that participated. So another 50 million people to go. So, a lot of work to do. You mentioned earlier, and I've certainly heard others and read about, there are certainly some concerns people have in terms of kind of wait and see. They don't necessarily want to access the vaccine at this particular time. So talk a little bit about why do you think that lack of trust or the wait and see approach is so apparent? And what can we as Advocate Aurora and other healthcare professionals do about it?
Yeah. So for those this term, but it really is true as, trust the science. I can understand why individuals may be hesitant. It is a new vaccine. a lot of this has been politicized, no matter which way of the aisle that you said. That gives people a little bit of pause, but the science is outside of the politics. And it has been shown to be effective in like 95% in terms of helping to prevent COVID-19. So with that particular point, it's, I guess I just reach out to the audience and that put politics aside, listen to scientists, listen to your physician, because that's where the valid information is and what you should be able to trust.
Yeah, no, great point. I mean, I think that there are people who are listening to the scientists, but obviously there's a lot of noise, right, about it. And you mentioned the point about political noise. But, you know, I think about this, Dr. Brown, how would you talk to, you know, take your doctor hat off, you know, how do you talk to your friends and family about this? Because, you know, you, like me, have friends and family that say, you know what, yep, I know your doctor and I trust you, but how do I overcome this thinking that the vaccine's worth it, so to speak?
Yeah, I think it's having conversations like this. The biggest thing that I go by, whether it be with my family or whether it be with my patients, is transparency. I don't recommend anything to my patients that I wouldn't recommend to my family member. And the thing is that people have questions. Some things we have the answers on and some things we don't. And thus us having this community talk today. But throughout, at least amongst like Black and Brown populations, there's been apparent health disparities. We've known that even before the summertime, where it became even much more broadcasted and out there in the news media. So there's lots of hurdles that we know we need to climb because the healthcare system hasn't always done right by Black and Brown populations. But in this particular case, with the science, and especially with COVID-19 hitting Black and Brown populations the hardest, I feel like it is a part of all of our duties to learn as much as we can about the vaccine, any potential side effects from the vaccine, so that we can distribute that information honestly, openly, so that people can make an educated decision about it based off of facts and not just on feelings, opinions, or even things of the past, which we know does impact our decisions today, but to really just to be open and get that information that people need out there.
Oh, that's great. That's a great point. I was listening to another webinar, and one of the doctors said it very simplistically by saying, this, not that, right? I mean, you think, okay, you know, yeah, you're right. The historical trauma, the other things that impact people's decision-making. But this time around, right, there was a significant number of trials that took place. Certainly the process moved fast, but that was because you had the United States government essentially paying for this work. I think both Moderna and Pfizer were very transparent in terms of the work that they were doing and sharing with people the percentages and numbers of people who were getting tested. And people should also know that testing is still going on, right? Because, for example, we don't know exactly how it impacts pregnant women. So testing is going on now around those issues. So I think there's still opportunity to learn even more, to the point you made earlier. So now that, you know, the vaccine's available, am I good? Can I just walk around and do whatever I want to do now because I've got the vaccine?
I would love to say yes, but the answer is no, not just yet. So just as you were mentioning about, we are still looking at things, studying. The key thing is that, one, we are convinced and know that the vaccine is safe for most individuals. In terms of, once you are completely vaccinated, that means you got to get both doses, at least in terms of both the Pfizer and the Moderna vaccine. The CDC is still recommending to wash your hands, socially distance, keep your mask on, because it's still not completely clear that for those who are completely vaccinated, can they still pass the virus on to somebody else, even if they're not having symptoms because they're now immune to it. So we still want to employ all of those safety measures that we have been for the entire pandemic to make sure we keep everybody safe.
Yeah, no, that's great. Dr. Haider-Shah, welcome. Thank you for joining us. Your time
Sorry,
is impeccable.
I apologize to everyone, including the audience, for being late. So, but an unpunctual doctor. Sorry.
Not a problem. I'm gonna, since you have joined us, to talk a little bit about. Dr. Brown was talking about the importance of the vaccine, but one of the concerns the community has, and all of us who are in healthcare, is the limited supply. Right? I mean, that's a huge issue. Talk a little bit about that for us, and talk a little bit about. We've heard a little bit that there's more manufacturers coming online. I think Johnson & Johnson was one of those companies. So talk a little bit about the limited supply and what additional supply may mean for us.
Yep. So I think, as we've gone live to vaccinating our patients this week, we're ramping up slowly, and we're looking at our most vulnerable population as well, and making sure we're vaccinating them based on the amount of supply. And part of this is, I think as time goes on, the amount of supply is going to go up. I mean, right now we've got the Moderna vaccine, we've got the Pfizer vaccine. Johnson & Johnson is actually not that far away. I think we're hoping for either late February to early March for that to be available. And the nice thing about that one is it's a single vaccine, so one time, one dose, versus the Pfizer and Moderna, which require that second vaccination as well. And then not too far off from that is the AstraZeneca vaccine as well. So that's not too far away as well. So probably around that March timeframe to expect that to be approved as well and be available. So that'll help improve the constraint of supply, and so that'll be part of it. I think the other piece is just some of the rules regarding the vaccine. And so for people to know that after you get your vaccine, we're going to be watching you for a period of time, 15 to 30 minutes, to make sure you're doing well, not having a reaction as well. So to make sure that you're safe with the vaccine. There's a small number of people that have had reactions to the vaccine, but really a very, very tiny number of people. And so, but because of that, we want to keep you safe. And so we do keep an eye on you afterwards for a short period of time.
Yeah, great. I do want to follow up on one of the points you made, though. You mentioned that the AstraZeneca and Johnson & Johnson are, at this point, suggesting that they're single doses. How are they in a position to do kind of a single dose versus the other companies who talk about, double doses? Do you have any sense of why that exists?
Well, so AstraZeneca is a double dose as well. It just so it comes down to just a type. So the vaccines are all a little bit different. They're manufactured a little bit differently. So as technology has improved, our ability to make vaccines has improved a lot, and the ability to make different types of vaccines. So the Pfizer and Moderna is an mRNA vaccine. So what they're doing is they've taken a piece of the mRNA from the COVID. So instead of getting all of the whole DNA structure, which you would get if you get the actual virus, you get a small piece of it. And it goes into your body, goes into a cell. Your body then makes that protein that your body makes antibodies against. The Johnson & Johnson, a little bit different. So they take another virus, a different virus, and instead of putting other information that what that virus would normally have, they're putting a little bit of the COVID virus, again, not the whole thing, but a tiny piece of that. And it forces your body to make that protein again. Your body then makes antibodies against that protein. And the AstraZeneca is almost the same sort of way. It works just a little bit differently, but it's really about just giving you the actual proteins, and then your body just fights it straight away as well.
Okay, thank you. Dr. Brown, before we open up the chat line, I'm going to ask you, talk specifically about, some of the work that you and the others at Advocate Aurora are doing as relates to the vaccine rollout, right? What's the approach Advocate Aurora is taking?
And so with Advocate, we really are big in terms of doing community outreach, reaching, of course, essentially the 1C. We are encouraging patients to sign up for our Live Well app. You can find it on Droid or the iPhone App Store, whichever type of phone you have. For those who may not have a smartphone, if you have an internet connection, and at least if you're listening to this, you probably do, you can go to myadvocateaurora.org. Once you do that, those patients that fit those categories that I had went through earlier in terms of phase 1A, 1B, we are doing direct outreach through communication through that electronic portal to say, hey, you are up next. Sign up. If you are open to getting the vaccine, we have it available for you. So I would really encourage and push all of the people in our audience to download that app or to go to My Advocate Aurora and sign on.
Yeah, you know, if I
Go ahead.
If I could jump in, I think so. I think it's the demographic information. We're only as good as the information we have in our system to reach out to you. So it's so important that your emails are up to date, your LiveWell app is up to date, your phone number is up to date, because if it's not, it's going to be hard for us to contact you when it's time to get your vaccine.
Mm-hmm. No, it's a great point. And, and I guess I would also throw in there is that we are looking for, partners in the community to help us with this, right? I mean, it's vitally important. I think you made the point, Dr. Brown, that talking with your neighbors and having that transparent conversation is critical. The science, trust the science for sure, but there are a number of people on the line today that can help us and serve as ambassadors around this information as the rollout continues. So I'm going to go to our chat line. Looks like we've got a number of questions that are being posed to us. And so I am going to try and see if I can grab a couple of them and see if we can have you guys respond to that. For those of us, you mentioned, Dr. Brown, I think for those of us who don't have computers, that, you may have you may not have a smartphone, but you might have access to the internet. What if I don't have that? What's my plan? Is there a phone number? Are there opportunities for me to call?
So I would say, at least for Advocate Aurora, we are working on creating a hotline of sorts to help our patients who do not have access to that technology. I don't have that information just yet, but I know that is something that's definitely in the works.
Sure, great.
Got that question, Vincent, I got that question. So we've got multiple strategies here. So we are currently in the process of doing emails right now. We will also be sending text messages. A text message will give you contact to the actual call center that will verify that you got the invite, and we'll get you set up for an appointment. We're also then looking at reaching out to, so we're upgrading our call center so we can call people directly and say, we've got you on the list. We need to get you a vaccine right now. Can we get you scheduled? So even if you don't have the technology, we will be reaching out to you, whether it's through the LiveWell app, through an email, through a text message. So as long as your phone got text message ability, but even then after that, then our plan is we're going to be reaching and calling people and having a person on the other line connect to you. So there's a lot of people. So I think one of the things I do want to just update, just when we look at the community, we're talking within Advocate Aurora, over 600,000 people that qualified for the vaccine in that 1B category, and so that's a lot of people we need to get through. So patience is going to be the key, because vaccine supplies we talked about is not quite there yet, but our goal is to get to every one of our patients and get them vaccinated as quickly as we possibly can.
Terrific. So, Dr. Haider-Shah, on that point, in terms of patients, I've seen and read about some of the other, health institutions in our community here in Milwaukee. Obviously, the government is playing a role in terms of standing up vaccine facilities. So, as we get more vaccinators, get more supply, in your best guess, what do you think might be the timeline where we can, get to the point that Dr. Brown raised about herd immunity? Is it, by summertime? Is it fall? Is it this time next year? What's your best guess?
Oh, I would say summer would be the earliest. I mean, so we're talking. I mean, so just amongst our patients, right? We're talking 600,000 in that first category. Then you look at 1C, then you're probably closer to 2 million people in that 1C category. And then you've got the rest of the community too. So, and then you're talking about the vaccine supply. I mean, so it all depends on how quickly we can get vaccine, how many different places we can get set up. But it's really about, how do we get everyone through? So it's going to take, I would say summer would be the earliest, probably more like fall before we're able to get, because after 1Bs and 1Cs then comes 2s. And 2 is everyone else. So that 1C category, and Dr. Brown may have mentioned this before I got here, was anybody over the age of 16 who's got health problems, right, is going to be in that 1C category. And then you're talking the rest of the community that are otherwise healthy under 64. We need to get to them, and we need to get to 70% to 75% of the community before we'll get to herd immunity.
Yeah, great point. Great point. One of the questions in the chat is, what is the vaccination that people might be allergic to, right? Have you guys heard conversation and comments around that, but that's one of the questions in the chat. What's the vaccine that people might be allergic to?
So the vaccine itself is not something people are normally allergic to. So I can tell you this. So of the Pfizer vaccine, there's been 23 people with severe allergic reactions and about 83 people with moderate allergic reactions out of 1.9 million people who have gotten the vaccine. So a very tiny number of people. The biggest thing is looking at the actual ingredients, and I know we do and ask, and so there's a way to look at the ingredients that are in the vaccine. If you're allergic to any of the components of the vaccine, then you don't want to get that vaccine. You may want to wait a little bit longer if there's a particular component that's actually in there that you're allergic to.
Okay, terrific.
Go to the cdc.gov website, and you go into the search vaccinations, and you can actually see, they have links in there so that you can see the components for both the Pfizer and the Moderna.
Oh, terrific. Thank you for sharing that. One of the current topics of the day are there are new strains of the COVID-19. And so one of the questions in the chat is, how should we answer patients' concerns regarding this new strain? And are the vaccines that are being produced effective against this new strain? Dr. Brown.
So at this time, they're still studying to make sure that there is still what we call like efficacy in terms of the vaccination. And everything thus far, it seems like, yes, this is still the case. It is a moving target, right? Because we're still learning, we're still growing. Out of what the vaccine is targeted at, that strain is still the more predominant strain in the US. The UK strain that people are talking about, that is starting to grow, but so far our vaccine still seems to be working against it. So I still would encourage people get vaccinated with what we have now.
Sure. One of the questions that continues to come up is, and Dr. Haider-Shah, you referenced this, the good work that Advocate Aurora is doing and others, right, about getting people signed up and getting information. Patience, right? That's a key phrase in all of this, being patient. What do you say to people who are calling and yelling for Dr. Haider-Shah to get on the line in West Allis Memorial, right? What are you saying to them? How are you trying to help them get through this? Because it's a little bit unsettling, absolutely.
Oh no, I mean it's difficult when you know that there's this possible treatment cure that can prevent you from getting it. You want to get it as quickly as possible, and we love that there's so much interest in getting the vaccine. But we're really looking at what's that vulnerable population? What's that population that if they've got COVID, they probably would not make it, and how do we get to them first? And that's really our strategy of saying, how do we get to those patients first? The ones that if they got COVID, they won't to do well. We need to get them vaccinated as quickly as possible. We're happy that everyone's got interest in getting the vaccine, but our goal is not just vaccinating, but saying how many lives can we save? So what's that population of patients we can get to help protect them and save their life so they don't get COVID and get some ill effects from that.
Yeah, no, good. Another great point. We're getting close to the end here, and before we sign off, I want to let everybody know that when you submitted your questions to us, we will be responsive and get the information back to you. I also want you to know that it is our intention to share the illustration that Sherelle is doing for us. We think that's another good way to be transparent about the information and get the data that you need to make your decisions. Dr. Brown, if you would have any closing statements, and then I'll go to you, Dr. Haider-Shah, as we kind of wrap things up.
Really, my closing statement is, please get vaccinated, encourage those around you. I got mine. And so that's really what I just want people's takeaway to be.
Yeah, terrific. Dr. Haider-Shah?
Yeah, my biggest thing is that we are going to vaccinate our community. We're working with all our community partners. We will get to everyone. It may take months, but we will get to every single one and make sure everyone gets offered the vaccine.
Yeah, thank you. Yes, we will. Yes, we will. And Cheryl, I thank you for your good work. I mean, the illustration looks great. Hopefully folks have been tracking with her as she's been trying to, provide another way of sharing this information. Again, ask you to pay attention to Advocate Aurora's website. AAH.org, where we'll have current and updated information for you. It's changing, as Dr. Brown talked about a little earlier. It is our intention to do more of these kinds of sessions. So look for those invitations and opportunities. And then please reach out. If you would like us to get together with you and partner on sharing some of this information, we're more than happy to do that. Again, I appreciate everybody being on the line today. Thank you for your good work and your support, Dr. Haider-Shah and Dr. Brown and others on the community relations and community health teams in Wisconsin. And again, and across Illinois. Again, thank you very much and have a great, great day. Take care.
Yeah.
Live well.